In 2019, the World Health Organization listed vaccine hesitancy as one of the top 10 threats to global health. Although it's not a new phenomenon, hesitancy has expanded dramatically in recent years, fueled by the COVID-19 pandemic, the rapid spread of falsehoods on social media, and a rising distrust in institutions. These forces have reshaped public attitudes towards vaccination across communities, countries, and continents. So what exactly is vaccine hesitancy? It's more than simply refusing vaccines. It's a state of uncertainty, a space where someone may delay, question, or selectively accept certain vaccines. It's not defined by a single action or moment, but by how people think and feel over time. Importantly, hesitancy represents both a moment of vulnerability and a window of opportunity for education and support. Hesitancy also exists on a continuum. It's not all or nothing. Many people fall somewhere in between, perhaps declining one vaccine but accepting others, or agreeing to vaccinate while still harboring doubts. People can move along that continuum as new evidence emerges, policies shift, or personal experiences change. Social media and news coverage often accelerate these shifts, magnifying concerns or reinforcing confidence depending on what people see and share. Ultimately, vaccine decisions are rarely shaped by a single factor. They emerge from a complex web of influences: personal beliefs, cultural norms, political identity, prior experiences, and the information sources people trust most. In this video, we'll explore the many factors that shape vaccine decisions and contribute to hesitancy, revealing how complex, emotional, and interconnected these influences can be. People's beliefs about vaccines are often shaped by their cultural norms, social identity, and political views. In the United States, these factors have strongly influenced decisions about COVID-19 vaccination and attitudes towards related behaviors such as mask wearing, social distancing, and even routine childhood immunizations. Polling from the Kaiser Family Foundation in January 2025 highlights a growing partisan divide in childhood vaccine confidence and behavior. Nationally, about 82% of parents say they typically keep their children up to date with recommended vaccines like MMR, down 8 percentage points from 2023. Among Republican parents, that share has dropped even further, to about 74%, with 26% reporting that they have delayed or skipped some shots, up from 13% the previous year. These divides are also reflected in public health outcomes. Analyses show that counties with higher proportions of Republican voters experienced lower COVID-19 vaccination rates, and in turn, higher excess mortality once vaccines became available. Healthcare professionals consistently rank among the most trusted sources for vaccine information, even among patients who are hesitant. According to the Kaiser Family Foundation tracking data from May 2025, 83% of adults say they trust their own doctor a great deal or a fair amount when it comes to vaccines. Among parents, 81% report that same level of trust in their child's pediatrician. In December 2024, and for the 23rd consecutive year, Gallup named nurses the most trusted profession in the United States. 76% of Americans rated nurses as having very high or high levels of honesty and ethical standards. This enduring recognition underscores the deep public appreciation for their care, compassion, and dedication. Across the board, healthcare providers wield tremendous influence. How they communicate, their tone, clarity, and empathy can directly shape vaccine decisions. Evidence shows that strong, confident recommendations, paired with storytelling or relatable examples, help build trust and acceptance, while rushed or dismissive encounters leave room for uncertainty or doubt. Social influence plays a powerful role in shaping vaccine decisions. People often turn to family, friends, and community members for guidance, especially when they feel uncertain or encounter conflicting information. Trusted peers can reinforce health behaviors for better or for worse. Those who delay or refuse vaccines frequently know others who have done the same or who share personal stories of negative vaccine experiences. These anecdotes, whether accurate or exaggerated, often carry more emotional weight than statistical data. Over time, individuals may gravitate towards social networks, online groups, or community spaces that reflect their existing beliefs and values around health and vaccination. This selective exposure can create echo chambers where falsehoods circulate freely and skepticism grows through repetition. The influence can be both local and virtual. A conversation at a family dinner, a post in a neighborhood Facebook group, or a video in an online parenting forum can all shape attitudes. Research shows that seeing peers endorse or decline vaccines can shift perceived social norms, making it seem more acceptable to do the same. Conversely, communities where vaccination is viewed as the norm tend to have higher uptake, as people don't want to be perceived as putting others at risk. By understanding these dynamics, healthcare providers and public health professionals can harness positive social influence, amplifying stories from relatable community members, making visible support for vaccination, and ensuring accurate information is present in the same spaces where falsehoods thrive. In today's digital age, social media has become a central source of health information. More than 70% of Americans now use it to stay informed about health and wellness topics. That reach makes it a powerful tool, but also a major channel for misinformation and disinformation. Misinformation refers to false or misleading content that is shared without harmful intent, often by people believing it to be true. Disinformation, on the other hand, is intentionally false content designed to mislead or manipulate, often to serve political, social, or economic goals. The impact of this content is substantial. Research shows that false information spreads faster and farther than accurate information. Even brief exposure to vaccine misinformation can lower a person's intention to get vaccinated, and anti-vaccine accounts today reach tens of millions of followers. Vaccine misinformation has been linked to lower adherence to public health guidance, reduced uptake of flu and COVID-19 vaccines, and confusion about vaccine safety. The combination of rapid content sharing, emotionally charged messaging, and massive reach makes it especially influential and potentially harmful. Not all vaccine decisions are made through deliberate, rational thinking. In fact, many are shaped by mental shortcuts, called heuristics, that help people make quick judgments when time, information, or energy is limited. These shortcuts can be useful, but they also open the door to cognitive biases, which are systematic errors in how we process and evaluate information. Some of the most common biases influencing vaccine decisions include omission bias, preferring inaction over action, even when taking action carries less risk. Ambiguity aversion, favoring a known risk over an uncertain one. Confirmation bias, seeking or accepting information that reinforces existing beliefs. Backfire effect, strengthening one's beliefs when confronted with contradictory evidence. Groupthink, adopting the views of a group to maintain harmony or belonging. Availability heuristic, giving more weight to vivid personal stories than to statistical data. Affect heuristic, letting emotions guide judgments more than facts. These biases can subtly distort how people perceive vaccine safety and disease risk, making them more vulnerable to fear-based messages or falsehoods. The risks associated with vaccine-preventable diseases are far greater than the risks of vaccination, a fact supported by decades of research. But that reality doesn't always align with how people feel. Humans often misjudge risk, especially when fear, emotion, or uncertainty are involved. For example, many people worry more about a rare vaccine side effect than a much more likely outcome, such as a hospitalization from flu or COVID-19. Emotions, media coverage, and social influence all play a role in shaping how risky something seems, regardless of what the data show. When it comes to risk perception, facts and feelings don't always move in the same direction. To see how these concepts play out in the real world, let's look at a recent example from Texas. Texas has historically shown strong support for routine childhood vaccinations, particularly in urban areas. But in rural Gaines County, vaccination rates among certain Mennonite populations have quietly declined over time. These communities are close-knit and culturally distinct. Many avoid outside media, maintain traditional lifestyles, and engage less with the formal healthcare system. While these practices help preserve cultural identity, they can also limit access to accurate vaccine information and increase vulnerability to false or misleading claims. There wasn't a single event that triggered the decline. Instead, public health officials observed a gradual erosion of trust in vaccines, influenced by factors such as rumors and false information about vaccines shared within religious and peer networks, skepticism towards government and healthcare systems, limited engagement with routine preventative care. By early 2025, MMR vaccination rates in this community had fallen below herd immunity thresholds, about 95% for measles. When a single measles case appeared, the disease spread rapidly, affecting families and raising widespread concern. This case illustrates how vaccine hesitancy can develop slowly, yet lead to serious consequences, especially in communities that are hard to reach or historically underengaged with public health systems. Vaccine hesitancy is complex. It's shaped by identity, values, cognitive biases, false information, and above all, trust. As a healthcare provider, you play a powerful role in building vaccine confidence, one conversation at a time. By understanding the roots of hesitancy and communicating with clarity, empathy, and confidence, you can help patients make informed choices that protect both their own health and the health of their communities.